Hello everyone, my name is Sarah Rylance and I'm a consultant paediatrician working at Queen Elizabeth Hospital in Blantyre, Malawi. I'm going to present a few slides on asthma management in children, which I hope will be useful for students and clinical staff and perhaps also parents, carers and teachers. I'm going to focus on the long-term management of asthma in these slides, rather than the emergency management of asthma in hospital. But before we dive into the management, why should we care about asthma? Asthma is the most common chronic medical condition in children. Untreated asthma can lead to severe asthma attacks and even death. According to the Global Asthma Network, across the world, roughly 1,000 people die every day due to asthma. Asthma symptoms of coughing, wheezing and difficulty breathing cause young people to miss school and their families to take time off work to care for them, which has costs for the family and the wider community. But importantly, asthma is treatable. And with the appropriate inhaler treatment, children with asthma can lead normal lives and do everything that their friends can. So what is asthma? Asthma is chronic inflammation in the airways in the lungs, which cause chest tightness, coughing, wheezing and shortness of breath. You see inflammation on the surface of your skin following an insect bite. The redness and swelling and irritation of inflammation are also found inside the lungs of a person with asthma. Typically, these symptoms come and go, and children might have particular triggers which make their asthma worse. There are many common environmental triggers, including dust, smoke, fumes, pollen from grasses, trees and flowers, changes in the weather, strong perfumes, animals and exercise. If a family is able to identify factors which make their child's asthma worse, then they can try to avoid the trigger if possible, and also make sure that the child has their inhaler available if they're likely to need it. So what's happening in the lungs to cause the symptoms of asthma? This slide shows a normal healthy airway at the top, in which the air can flow in and out easily and the person will be able to breathe freely. The asthmatic airway at the bottom is narrow due to two problems. The muscles around the airway become constricted and tight, which narrows the tubes. Asthmatics also have inflammation in the airways, which causes tissue swelling, mucus production, and makes the airways very sensitive. The narrow airways mean that it's difficult for air to move in and out of the lungs and cause symptoms such as cough, wheeze, difficulty breathing and chest tightness, which are often worse at night or after exercise. So when we think about asthma and how to treat it, it's important to think about both of these components, bronchoconstriction or tightening of the airway muscles and inflammation. I'm going to talk now about the different types of inhaler which we have to treat asthma. Inhalers are the best type of treatment for asthma. But there are many myths about inhalers in the community. Inhalers are not addictive, they do not make the lungs weak, and they're much more effective than tablets, syrups, and traditional medicines in treating asthma. These are the treatment guidelines which we use in Malawi. They refer to inhaled salbutamol and beclomethasone, and also mention the importance of asthma education. Generally, we start with a salbutamol inhaler to treat symptoms as needed. Children should take 2 puffs initially, and can have repeated doses up to 10 puffs if they need. If symptoms are causing disturbed sleep, the child is missing school, or if they've been admitted to a health facility, then we should also add in an inhaled steroid like beclomethasone. So how do the different inhalers work? All asthmatic children should have a bronchodilator or reliever inhaler such as salbutamol, which they use when they're having symptoms. Salbutamol is a short-acting beta-2 agonist, or SABA, which relaxes the muscles surrounding the airways and allows them to open up. It is effective almost immediately and lasts for about 4 hours. This means that symptoms might get worse again after 4 hours, and so the child should be reassessed and given repeated doses if needed. If a child is needing to use their salbutamol inhaler frequently, say more than 3 times a week, or having really troublesome symptoms which are interfering with sleep, school, or requiring emergency visits to healthcare facilities, then they should have an inhaled corticosteroid or preventer inhaler. Inhaled steroids, such as beclomethasone, work by reducing airway inflammation. Children should use this inhaler every day, even when they're feeling well. The effects are not immediate, and so they will only start to notice a benefit after about 1 week. Steroid inhalers come in different strengths. 1 dose or puff could deliver 50, 100 or 200 micrograms, and so it's really important that the child and their family know how they should use the inhaler that they have been given. All inhaled medication is best given using a spacer device. This is a plastic chamber into which the inhaler is fired. The particles of medication are held in the chamber or space, and the child can breathe them down into their lungs. Here's an example of the kind of spacer that we use in Malawi. The inhaler fits into the end, and when the inhaler is fired, the medication enters into the chamber and is held there. Why should children use a spacer? Well, the top picture here shows what happens when an inhaler is used without a spacer, by releasing it directly into the mouth. If patients are going to do this, then they have to coordinate taking a deep breath in at the same time as pressing the inhaler down and keep their breath held for 5 seconds. And this is not easy. Most of the medication ends up coating the mouth and the throat and being swallowed into the stomach. Using a spacer means that much more of the medication is breathed into the lungs, which is where it needs to be in order to work effectively. This is particularly important for younger patients and for anyone during an acute attack when patients struggle to coordinate their actions. In high-income settings, commercially manufactured spacers, such as this one, are available. However, these are often not available in low-income countries, or if they are, they're prohibitively expensive. The good news is that it's possible to make a homemade bottle spacer out of a 500 ml plastic bottle. The bottle must be clean and dry so that the particles of the drug do not stick to the inside. In order to cut an inhaler-shaped hole in the end of the bottle, it's helpful to use a hot knife or wire which can melt through and cut the plastic. Although this bottle inhaler might look inferior to the commercial spacer, good research from South Africa has shown that a homemade spacer can be just as effective. The most important thing is that children actually use a spacer when they're taking their inhaled medication. However, the bottle spacer does have to be made correctly, and this slide shows a few bad examples where there has been confusion over how to make the spacer. You have to make sure that families really understand clearly how to make one at home, or even better, to give them one which has already been made. This short video shows how to help a child to use their inhaler and spacer. First of all, you need to shake the inhaler and then put it into the hole at the end of the spacer. The child must seal their mouth around the other end of the bottle. Press the inhaler down and encourage the child to breathe in and out deeply 5 times for each puff of the inhaler. This allows the particles of medication to enter the lung where it can be effective. Repeat the process for each puff that has been prescribed. The technique is the same for both Salbutamol and Beclomethasone inhalers. Older children will be able to do this by themselves, but younger children will need help, like the girl in this video. Finally, I want to talk about the most important part of long-term asthma management, asthma education. There is no point in giving expensive inhalers if the family do not understand why they need to use them or how to use them properly. Children should have a plan and know what their regular treatment is and what to do if their asthma is getting worse. Asthma education does take time, but it's hugely important to young people and their families and might even save their life during an acute attack. And so to summarise, asthma is a chronic condition and needs long-term treatment with inhaled medication. We need to think about treating both airway tightening and inflammation, and so we have 2 different types of inhaler. Reliever inhalers, such as Salbutamol, which children should use at the time when they have symptoms, and preventer inhalers, like Beclomethasone, which should be taken every day to reduce the inflammation in the airways and help to prevent attacks. Using a spacer means that a much greater amount of medication will reach the lungs where it needs to work. And last but definitely not least, asthma education for the child and their family is so important. By taking time to explain to young people and their families, we're empowering them to take control of their asthma and helping them towards a healthy and active future. If you want to keep up to date with the latest asthma guidance, GINA, or the Global Initiative for Asthma, produce a yearly report which can be found on their website. Although many of the medications are not currently available in low-income countries such as Malawi. Thank you for listening, and I hope you found this short video helpful.